All right, good evening, everyone. Thank you for joining us. We're going to go ahead and be prompt here and get started right on time. My name is Chelsea Hoffman. I am a registered dietitian and a physician assistant. I'm the former chair of the NANS Advanced Practice Provider Subcommittee. Thank you so much for joining us tonight for an important conversation about burnout and the impact on the healthcare team. I'm going to introduce the other panelists here with me in just a few moments. I'm going to share my screen first so you can see my slides. There we go. All right. So here with me tonight, I have Dr. Ryan D'Souza, and I also have Megan Filoramo. Unfortunately, Dr. Sheem was not able to be with us here tonight. There was something urgent that came up, but I will let Dr. D'Souza and Megan introduce themselves here. I'm going to stop the share for a second here so I can see. Megan, why don't we have you go first?
Hi, everybody. My name is Megan Filoramo. I am a nurse practitioner. I work in chronic pain. Well, I guess I work in pain management. Most of what I do is chronic. And I'm here in New Jersey, so hopefully I don't talk too fast. I'm also an integrative health and wellness nurse coach. And I'm really excited to be here. I'm an active member of the NANS APP group. I'm also on the board of directors for the American Society of Pain Management Nursing. So it's important to me that we all can keep doing this important work, and I'm happy to be here as part of this panel tonight.
Excellent. Thank you, Megan. Dr. D'Souza, why don't you go ahead and introduce yourself?
Yes, thank you for having me here, this wonderful panel. My name is Ryan D'Souza. I'm currently a pain medicine physician at Mayo Clinic in Rochester. I direct the neuromodulation practice here. In terms of my involvement, I do a lot with the NANS Society. I'm a former chair for the NANS RFS, the Residents and Fellows section, and Young Neuromodulation section. I'm very involved in NANS and ASRED. I look forward to doing this important work and speaking on important topics like burnout. So looking forward to this discussion.
All right, perfect. Thank you. And I just want to give a special thank you to Dr. D'Souza. It's important to the APP committee and of course to NANS at large to show evidence of how we can collaborate with one another from an interdisciplinary standpoint. And so to have these types of panels where we're joined with all comers to the healthcare team and can discuss these important topics, I think it's a wonderful effort on behalf of NANS. So thank you for joining us. We appreciate it. So I'm going to go back to the slides here and we're going to keep it going. All right. And of course we have to go back to presenter mode here. Okay. So here we go. So our objectives tonight are to explain the 3 subscales utilized to measure burnout. We are going to talk about burnout screening tools that are available to anyone that would want to take an assessment and see once how they rank, and kind of what we can do to prevent burnout in ourselves and also support our colleagues in the prevention of burnout. So let's start out with a definition here. I think burnout is a term that's really utilized very loosely nowadays. We say that we're burned out from, the same workout that we've been doing day in and day out. We're burned out from the same food that we've been packing for lunch. We're burned out from being around our kids and kind of dealing with their shenanigans or their antics. And really, if we go back to the truest definition of burnout, this was a term that was coined in the 1970s by Dr. Christina Maslach and her colleagues as they were just starting to do research on burnout. And what they found is that it really is occupational, and it's kind of defined by 3 subscales, and those are emotional exhaustion, cynicism, and reduced professional efficacy. And I'm going to pause here because, those 3 words are in their terms, but what do they mean? And so a lot of people feel tired, right? Everybody's using caffeine nowadays to stay awake throughout the day. But when we're talking about burnout and emotional exhaustion, it's on a whole nother level. This is kind of fatigue that is impacting your activities of daily living. No matter how much you sleep, you still feel like you're run down. And so it's on a different level. And when we're talking about cynicism, it's that sense of sort of being jaded or cynical, and maybe towards things that we weren't previously feeling cynical towards, maybe our colleagues, maybe our patients. And then reduced professional efficacy. And what does that mean? Well, maybe we're sort of losing the sense of meaning in our work that was once fulfilling. Things that gave us drive or, inspired us in our careers just don't have that same hold anymore. And so I like this slide because I think it's really important to just lay the foundation of what is it that we're talking about, what is burnout, and kind of how is it made up by these three different subscales. So how do we screen for burnout? There's the Maslow Burnout Inventory, and that's considered pretty much the gold standard in clinical research when we are looking at burnout. And again, it measures it on those three subscales that I just mentioned. And that one was created by Christina Maslach and her colleagues. There's multiple versions of it available. It is proprietary. It's owned by the company Mind Garden. And so if you Google Mind Garden or Maslach Burnout Inventory, it also goes by MBI. There's a general survey, a student survey. There's all sorts of different versions of it. But just know that it is something that you have to pay to take. And then it kind of spits out a specialized report that ranks you and shows you kind of where you land at risk for burnout. Now, I'm also familiar from my previous time working for over 8 years at Mayo Clinic in Rochester, Minnesota. There's the Mayo Clinic Wellbeing Index. And so this was developed by Mayo Clinic researchers. It also has multiple different versions. So if you're a pharmacist that's wanting to take it, a nurse, a resident, a fellow, an advanced practice provider, there's versions for everyone. And so you can look that one up online too. I'll make a note here that there's lots of free screening instruments available, but just know that how valid they are may be kind of up for interpretation based upon the questions that they're asking. And honestly, at the end of the day, if anyone feels that they're at risk for burnout or impairment, it's something that you should probably talk to your provider about, or a healthcare professional, a mental health professional for sure. And so since we just spoke about the Mayo Clinic Wellbeing Index, given that that's not one that is owned by Mind Garden and harder to get the results from, I was able to get the results from the Mayo Clinic Wellbeing Index from 2022 to 2023. And so these were all comers that took that Wellbeing Index. And we see across the board here in all different healthcare specialties or careers, I should say, I mean, we're seeing greater than 50% of folks who are at risk for burnout. And so this is, of course, concerning, right? And we know that there's been an uptick since COVID, particularly in the nursing population and in the pharmacy professionals. That's kind of when we started to see those two subgroups on the rise. It hasn't quite come down yet. And so I just put this up here because I think it is really staggering statistics to see how high this is. And so with that, I'm going to pause my screen share for a moment here because Dr. D'Souza also has some additional research and findings that he's going to share with us tonight.
Perfect. Thank you, Chelsea. So I wanted to start off by sharing this quote that as healthcare professionals, we tend to forget. And we're busy taking care of patients and, doing other administrative duties and research and a bunch of things. But honestly, as the quote says, the most important patient we have to take care of is the one in the mirror. And this quote does resonate with me. It was stated by the former AMA president. And I think this is one thing that we tend to forget a lot of times. Chelsea earlier shared some statistics from the Mayo Clinic database. This figure that I have on the screen here is specifically published in the Mayo Clinic proceedings. And it shows the various different specialties and the burnout rates for different healthcare professionals. And you can see the orange denotes the rates of burnout in 2011, and the blue denotes burnout in the year 2014. You can see the emergency medicine specialty tends to experience very high rates. Almost all specialties in 2014 were exceeding burnout rates greater than 50%, which corresponds to what Chelsea shared earlier as well. And when you look at the mean burnout amongst all physicians here, you can see that it was already high to begin with in 2011, and in 2014 it increased even more. Now, obviously, this data is definitely outdated. I would imagine it would be even more now since the COVID pandemic. But this was the most recent data that was published in the Mayo Clinic proceedings. Now, what does this all mean? So I'm gonna try to break down these next couple of slides in terms of what the consequences are for clinicians, what the consequences are for patients, and what the consequences are for the healthcare system itself. So, as Chelsea had mentioned earlier, the consequences of clinicians are pretty can be pretty profound. She mentioned the high risk for depression, but there are also other risks such as risk for abusing chemical abuse like alcohol abuse. And drug abuse. And there's relationship problems. When you're not in the right emotional mindset, you tend to treat others, including your loved ones and your friends, poorly. There's also a high risk of suicide. Now, because of burnout, there can be a high rate of reducing your work hours or just leaving the practice altogether. And what that can do is it could potentially have a viral effect where when you're leaving, the clinicians and the healthcare professionals that remain in the practice can also experience the negative effects of that, not only in terms of work burden, but also just seeing another colleague who's leaving who has had burnout, and they might also potentially face that burnout as well. Now, what does this mean for our patients? Well, if we're not in the right emotional mindset, if you don't have good emotional well-being, and if we're at risk of burnout, that could translate into our clinical practice. There's a high risk for medical errors, and medical errors can lead to malpractice. Furthermore, there's also a low risk of patient satisfaction, and then just trying to establish that patient rapport and getting that patient to buy in and agree with the treatment plan might be also harder to do. And then there's also studies that have shown that there's an association between physician burnout and higher risk of mortality, patient mortality rate, and worse patient safety scores. I'm getting to the end of my slides here because we don't want to make this a lecture. We want to make this more of a discussion here. In terms of healthcare systems, there's also lower quality metrics. As I mentioned earlier, because of physicians having higher risk of errors, there could also be higher litigation rates. And as I mentioned earlier, too, physicians leaving the healthcare systems can also lead to worse employee turnover, and that in turn can lead to a poor economic productivity. And then finally, this is my last slide. I just want to share some of these risk factors that can predict burnout. Now, again, these are not perfect risk factors, but again, there's a high correlation that studies have shown. We often hear that perfectionism, we're all perfectionists in the healthcare, all healthcare professionals, I feel like, are perfectionists. We make it here this far because we tend to perfect our skill and our art, and we all do that to ensure perfect and great care of patients. But that too can if you take perfectionism to the extreme, sometimes that could have negative consequences, and that could it could lead to burnout. Similarly, not having great coping skills is also a potential predictor. Lack of time for caring for yourself, and then also having non-work related things such as having stress and strain at home can also lead to burnout. And then at the work itself, delivery of care of complex patients is a big risk factor. As I mentioned earlier, when I showed that graph, we showed that the emergency medicine physicians that are high risk, they tend to care for more complex patients compared to other healthcare professionals. Having a lack of control, career satisfaction, having errors that you perceive in yourself in your clinical practice, and other things like time pressure and having a low autonomy are also predictors of burnout. So I'm going to stop sharing my screen there. I'm going to turn back over to Chelsea.
All right. Thank you for that, Dr. D'Souza. I think that just helps lay the foundation for the discussion that we're about to have. And so as we move into kind of the question with our panelists or question portion with our panelists tonight, if anybody that's on the call has any additional questions that they would like me to pose to Megan, Dr. D'Souza, or even I can weigh in as well, please throw those in the chat, and I will kind of keep an eye on the chat as we move forward here. But to get us kicked off, I think one thing that I would ask both Megan and Dr. D'Souza, whoever would like to go first, maybe Megan, we'll start with you since Dr. D'Souza just finished up, but how do we increase that sense of support within the workplace to try to help prevent burnout, either, you know, in ourselves or in our colleagues? What ideas or thoughts do you have about that?
I think that's the golden question, right? How do we help ourselves and how do we help all the people that we're around? But I think first, I think it's important to note that burnout, it's not an all or nothing type of thing, right? Like, it's not like, oh, you're burnt out or you're perfectly healthy. It's kind of this spectrum, right? And so, like, there's going to be days when you're kind of a little more towards the burnout. So we want to kind of stack the odds in our favor and keep getting back over to the side of the spectrum where we do feel healthy, right? It's more like eating healthy. It's not something that you accomplish once and then you're good to go, right? It's something that we have to do continuously. And I think that there's a couple things that can really help in the moment. And I think one of them that may seem obvious, but I think can get lost is really bringing the focus back to the patient. And, you know, I work in an outpatient office primarily, and things can get kind of crazy. You know, there's a lot of people on top of each other and there's a lot of drama going on. But all of that stuff distracts us from the patient. And the problem with that is then we feel like we're not giving good care, right? So we're rushed, we're distracted. Then we weigh in on how our care is. And that whole compassion satisfaction, you know, we talk about compassion fatigue all the time. Nobody talks about compassion satisfaction, right? And that's really the antidote. So bringing the focus back to, like, why are we here? Are we here so that we can all have a smooth day? Or are we here to give good patient care? And it brings it back to the truth is we are all there to give good patient care. It's something we all have in common. If it's the front desk person, if it's my medical assistant, if it's the x-ray tech, we're all there because we want these people to feel better, right? And so when we can kind of bring it back to that and stop worrying about who said what and where and when and how much work we have to do, I think it can really bring it back to the meaning. So it can give you back the satisfaction, and it can really kind of root you in your why. And I think that's really important, because when we lose sight of that, everything goes to pieces. And it may sound idealistic, but like literally just focusing on the person in front of you, even if you don't have all the right equipment, even if you don't have the time, even if you don't have, you know, the help to spend 20 minutes, spending 2 minutes can be good enough care if that's the time you have. So I think, and it kind of takes champions to do that, right? It's awkward the first time when everybody's complaining. They don't want to hear like, oh, like we're really helping this person. But sometimes just offering another perspective without being aggressive or judgmental. Like, I get it. Like, and if any of my coworkers are in here, they're probably like, wait, she complains sometimes too. But, you know, bringing it back in and just kind of offering another perspective, I think can be sometimes all it takes to just stop the ball from rolling to the wrong direction.
That's great. I love that. So I'm hearing things like finding your why, bringing it back to the meaning of what we do, offering another perspective, really being present for people, whether it's our patient or our colleagues. Those things are all important. Dr. D'Souza, do you have any thoughts in terms of kind of how do we bolster that support within, you know, the healthcare team for one another, you know, for ourselves to prevent impairment or burnout?
Yeah, first of all, I would like to say, Megan, your every single word you mentioned was just excellent and resonates with me. You know, I do think we tend to, you know, not place an emphasis on patient care, and we, you know, a lot of times as healthcare professionals, we focus on the other things like the politics and the other stuff in the workplace. And when you just take a step back and see all the wonderful care that we're delivering to patients and kind of make that the focus of our jobs, which is why we're doing this in the first place. I think it certainly gives a certain level of satisfaction that's and kind of appreciating that kind of satisfaction is a big deal. So to answer your question specifically as well, Chelsea, so you mentioned how do you support yourself and then how do you support others? I'll first start off with kind of talking about how, you know, I support myself, because, and as just to also kind of also echo as Megan just said, you know, burnout is on a spectrum, and all of us might have been on that spectrum at some point. I can say that for me personally, as an early career physician, having been through medical school and residency and fellowship, and then also just early staff, I've gone through different kind of variations of burnout, and some days I might be just fine, and other days I'm like, oh man, I'm not doing too well. So things I've done to support myself. So I think, and a lot of these things I've kind of learned over time. And the number one thing is kind of setting clear boundaries between work, personal life, and then just like leisure itself. So what I mean by that is, kind of, saving home for home, saving work for work. I think, the COVID pandemic has kind of changed a lot of things and has made things like virtual education and lectures, like, such as this, for example, a normal thing. And, I'm trying to set boundaries between that and kind of limiting my time home to, to just, to me time and my family time, and then, and then focusing on work as work stuff. The other thing as Megan just also mentioned, kind of finding joy in the things that you do at work. And so I find joy in taking care of patients, but also I'm very passionate about research. And so I find a lot of joy in research as well. And again, one can just kind of be fixated on the details of research and the politics of research. And then if you kind of take some of the tips that Megan just mentioned, just take a step back, see what you're doing in terms of research advances and how that research advance can help a lot of patients and advance patient care. If you look at the big picture, you can get a lot of satisfaction with that, versus, worrying about small things like, oh, which journals is this thing going to get into, or is this going to impact my H index, or, oh, I should be first author or corresponding author. So instead of worrying about the politics, it's kind of taking a step back and kind of looking at finding joy in the things that you're doing and finding purpose and meaning. The other thing I've kind of implemented in the last few years has been also fitness. And I know this is kind of a cliche, but I think, finding time to take care of yourself, we always preach to our patients, physical therapy, exercise therapy, that'll take care of your pain. But, physical therapy, exercise therapy can also have a lot of mental health benefits. And so I've kind of placed an emphasis on that as well. And just, working out 5 times every week, I think has really done me some good. The other thing I should also mention is, we all work in academic centers, but also in private practice settings, there's always politics in our workplace. It's very easy to kind of get fixated on those things too. And so, and sometimes, even if you try to avoid the politics, you might still get dragged into that kind of stuff. And having, close friends and families that you can vent to during those times is important. I depend on my family and my friends, especially during those times when I need to kind of get things out and get it off my chest and just, kind of unload. So I think that helps out a lot as well. Another thing that I mentioned earlier as a risk factor for burnout was perfectionism. I mentioned that all healthcare professionals, I feel like, are perfectionists. And because of that, a lot of times we are hard on ourselves. So I think, when I have a trainee, for example, I have high expectations for trainees, but I tend to, I always temper and I make sure I give positive, constructive criticism. You can still give negative feedback, but delivering it in a more constructive way is very important. But we tend not to do that to our own selves. And so I think, all of us being perfectionists in our field, we should also be nice to ourselves and give ourselves constructive feedback and, highlight things that we did well, and then highlight things that we could potentially build on. And then, there's opportunity for the future for improving. And then I would also like to end in terms of this question by saying that, I think it's okay to say no to a lot of things. And that might be, it's another cliche thing to say. I could tell you that when I came on staff early, as well as when I was a resident and fellow, it's very hard to say no, especially to people who are in kind of in a higher role or in higher power, like your chair or your program director. It's very hard to say no to things that they ask of you. I would say that if you say yes to everything, at some point things will get unbearable. It'll be hard to kind of maintain everything, and then your quality of things that you could deliver at each one of those activities that you're saying yes to is going to significantly diminish, and it's going to hurt yourself at the end. So what I've done is I've said no to a lot of things, especially if they don't fit my interests. It's hard though, because sometimes there are things that you really want to do and want to get involved in, but you don't have the time or bandwidth, and you have to say no to that as well. There have been opportunities that I've said no to that I wish I said yes to. things that have, led to like high impact publications, for example, and I just missed out on it. But when I kind of take a step back again, think about how much time I saved from saying no in those type of activities, it brings me satisfaction to know that I've at least said no to that, and that's kind of afforded me a better work-life balance. So I'll stop there to that question there, Chelsea.
So many pearls and nuggets of wisdom there. I love that. That was great, Dr. D'Souza. Thank you. Megan, anything after hearing Dr. D'Souza's response that you would want to add?
I always have stuff to say. Well, so I do think, a couple things. I think one of the things that I found helpful for myself working in private practice, I'm not around a lot of other nurse practitioners. I have a coworker who's fantastic, but I don't see her a lot because she's busy seeing a million patients too. But I think one of the things that research has shown is protective against burnout is a sense of team, right? And I think that's what oftentimes gets people all riled up, is what their team is doing or isn't doing, or are they a good team or are they not a good team? But your team doesn't necessarily have to be the people that you're working with day to day. And I think that's an important thing to keep in mind. Like, I have found an amazing team of people through the APP group at NANS, right? I didn't know any PAs in pain management. I didn't know any, not one. And now I have people I can call on the phone and be like, listen, I have this question. Or, we do certain types of spinal cord stimulators, but we don't do peripheral stimulators. Or if I have a tricky question and I don't really necessarily want to ask somebody who knows the patient, I want an outside person, I have a whole community of people. I have that through NANS. I have it through ASPMN, the pain management nurses. So I think I would just kind of say, like, if you're like, oh, well, I can't get that, like, think outside the box. Like, there's a lot of people that can be your team. And that has been shown to be protective against burnout. The other thing is this lack of control, right? Like, this idea that we have no control. And in some respects, we don't, right? There's a lot of things that we don't control. We don't control all of our patient outcomes. We don't necessarily control our schedules or whatever. But one of the things that I've done that has been very helpful to me is to decide that I'm going to control how I feel that day. And basically, the way I do that is by picking some kind of thought at the beginning of the day that's going to make me feel that way. And that's like one of the coaching things that I've learned through coaching. But I literally take a piece of paper and say, like, I want to feel calm today. Okay, so what do I have to think today to feel calm? And it might be something like, I can handle whatever comes up, or what I'm doing here is important, even if it's a mess. Like, so I think that's one of the things. I don't write huge journal pages. Literally, it could be on a Post-it and like stuck on my computer. But I do think kind of finding all the things that you do control in your day can actually be very freeing. And it's your perception of control. It's not your actual control that's preventative against burnout. So, perceptions within our reach. So that's the only other thing that, I mean, I could go on and on, but I'll stop it there.
I like what you just said there, Megan. And before, I just want to kind of just say that it happened to me today. Today I was one of those days where everything in the morning and afternoon was just going absolutely wrong in terms of patient care, like, things that I was, not anticipating happening or happening. And I was like venting, I was complaining, I was, I had this long text thread with one of my best friends, and all it was were just complaints, and I was just, trying to unload and vent. And then at the end, I just texted him back, and I'm like, you know what? I'm going to stop complaining. The rest of today is going to be no more complaints. I reached my quota for venting or quota for complaining, and I'm just going to just make sure I just relax a little bit and just I'm going to make sure I have a better day now, just because I'm just going to think more calmly. And so just I'm glad that you mentioned that lack of control. There's only so much you can control, but you can at least control how you react to things and how you're going to let it impact. So.
Mm-hmm.
That's good. Thank you, guys. One thing that I'll add here, in terms of supporting our colleagues and preventing impairment and burnout within the healthcare team, there's a few additional things that they have found in research. And one of those is offering authentic praise or gratitude. right? And so we don't need to give like high fives, right, to the team for every single little thing. But I think genuine gratitude or appreciation for a contribution of somebody that's on our team, something that they did, or just their general presence and being there and being a part of things, I think that can go a really long way. People don't always hear that, especially, when I think back to my time in clinical practice, especially right from the top down, people that we look up to, the hierarchy, I think, especially from leadership, right? Calling out people that are kind of like our front lines and giving them that job well done when it is appropriate to do so, it can go a really long way. And so I will say authentic praise, gratitude or appreciation. And then one of the other things that I was thinking of that they've shown in research is like true listening and attention. And I think about, and I'm sure you guys can all think of when you do this, I did it all the time. I'd have a colleague that came in to like try to tell me something, and I'm right in the middle of like writing my note and trying not to get behind, right? And so I'm like typing away, tap, 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 tap on my keyboard while they're talking to me from the side. And I literally like didn't even stop typing or turn to face the speaker. And I've done that so many times. And now I just kick myself, because if I could go back, I would be like, no, stop. And give them your attention, let them say what they need to say, but really showing that you're present, that you're listening. You offer some of those reflective statements back, right? So they know that they're being heard, and just people feeling like you're there with them, you're hearing them, you're available, even if it's just for a couple minutes of your time, that can go such a long way for someone that really needs it. And so I think, truthfully, I know myself, and I would imagine the majority of us could do a better job with that. And those are easy things, right? Giving someone kudos when it's appropriate. Stop typing, stop texting, and give someone your eye contact, your attention. Those are little things that we can adjust throughout our day that can have a great impact. So I would just add those in here as well.
I think the added benefits to that, Chelsea, obviously, is it supports the team, but you feel good when you do that.
Yeah.
Right? Like it supports the team, but it also comes back and supports you, because you want to be the person who's listening. You want to be like, so then, it's that give and take.
Yeah, that's a great point. I didn't think about it that way, Megan. Megan, a specific question that I have for you. So I know that you do nursing coaching. And I would imagine, we just looked at those staggering statistics, right? Showing what percentage of nurses are showing that they are at risk of burnout. And so when you are doing these coaching practices with these nurses, what are you finding as they're speaking with you? Do they give you a sense of what the underlying drivers are of them feeling that way or kind of trending towards burnout?
Yeah. So I think one of the big things that I've seen, which has really actually been sobering, and I didn't anticipate this when I first started doing this, was the level of trauma in nursing, trauma of the providers, trauma of the nurses. And so when I kind of dove into this a little bit, when I went to school, trauma was like something that was from like Vietnam vets had trauma, or victims of sexual assault had trauma. But like we don't think of us going to work and having trauma. But really, the definition of trauma is too much for your nervous system too fast, right? It's just too much too fast. You can't deal with it. And because of that, you have, neuroplastic changes, not unlike the neuroplastic changes with chronic pain. And I think, really, especially it was before COVID, but it's more and more now, is just this overwhelming kind of everything was too much too fast. And because of that, the defense mechanism is to pull in and protect, right? Unfortunately, when we pull in and protect our resources and protect ourselves, what we're unknowingly doing is separating ourselves from connection, which is then what protects against burnout, right? So we're pulling in to protect, and it's making us worse. And I think, honestly, the more I talk to nurses, when we talk about it a little bit, they're almost relieved to find out, like, oh, this is trauma, right? This is too much too fast. The futility of care. I mean, I was working outpatient during COVID, and it was terrible. what people went through inpatient. I mean, my coworker at the time was working in occupational health, and outside her window of the hospital were the tents where they were keeping the refrigerated trucks for all the bodies. Like, it's trauma. So I think if we can just have some understanding and compassion, like, nobody would expect crazy things from somebody who's been traumatized. And it doesn't mean everybody has PTSD. You know, trauma is treatable. I think, you know, in the same sentence of it, there's so much trauma, trauma is really treatable. But the first step is acknowledging it and having some compassion that we've gone through something very, very difficult that might have been too much for us to handle at the moment. And that's why we're having all of these other symptoms now, is because our body is screaming out like, hey, you know, take care of me. And so I think that's one of the things that, like, just this weight, right? And with that, then they feel, this is where that lack of empathy comes in, right? Nobody wants to not be empathetic. Like, we want, it feels terrible to not be empathetic, but then you feel guilty for feeling terrible for not, you know, like, we load on the guilt on top of it. But again, I think if you can just see it as a faulty defense mechanism, right? You're not leaning out because you don't actually care. You're leaning out as you're protecting yourself. So I think it just kind of starts with the understanding and the compassion, and like, oh yeah, maybe I went through something really tough, and it doesn't mean I can't heal from that, but I have to heal. And I think kind of across the board in healthcare, we're not good at picking up on the signs of our bodies. Like, I thought when I started this work, like, I could just think my way through it. I like thinking things through and brainstorming and problem solving and writing nice lists with gel pens and my nice notebooks. But the truth is we really have to deal with the healing of the body. And like, so this is why people with exercise do so well. But a lot of people aren't exercising now. And the problem in healthcare is we don't listen to our body. If we have to pee, we don't. You wait. If you have to eat, you don't. You wait. You know, you come out of a really emotional situation, you have a breakdown and cry. No, you wash your hands and you go into the next room. So we've kind of gotten into this habit of shutting down what our body is telling us. And it's not the end of the world. We just need to tap back in. Like, oh, okay, and start doing some of this body work, the exercise or breathing or mindfulness or tapping, or listen, you can get outside and shake and dance if you want to, but like, we have to like kind of bring some up. So I know that's like a long rant on whatever you asked, but I think really the problem is that there's been a lot of trauma in healthcare and caring for people. The rates of secondary trauma are huge. I mean, that's a whole nother research, you know, pool that we could jump into. And so I think that in general, we just need to have more understanding for ourselves, and that might take us trying to think of ourselves outside, you know, like from a third person view. So it's really because people are trying so hard, right? They want to do a good job. And if you feel like you're failing at that and you're trying to protect yourself at the same time, it's tough.
That was amazing. Thank you for that, Megan. So much information there. And I can tell that you have so much experience in this area. So I really appreciate that. You gave us the nursing perspective, and so that's helpful. Dr. D'Souza, I'm going to turn it over to you. I'd be curious, you know, from your conversations and working within the physician space, what is your sense of, you know, I'm sure you've seen some provider turnover. What is your sense of things that are driving maybe physician burnout, or have you seen some of your physician colleagues in burnout, and what did that look like? If you could maybe speak to some of those things.
Yeah, absolutely. And before I do, I want to say, Megan, you kind of blew my mind away. Just a lot of the things that you mentioned was so very, very high impact stuff, and some things that I've just not even thought about before. You know, like you mentioned the neuroplasticity and stuff, and it kind of makes sense. You know, just like how we think about pain and how, you know, you have wind up phenomenon and central sensitization, and there's, you know, changes happening centrally. It can very well, like you said, happen, you know, in terms of burnout and how we tend to kind of shut down our own, you know, taking care of yourself, and how that, you know, that trauma can also centralize and have neuroplastic changes. So I think that's a very important point that you mentioned. Going to your question, Chelsea, the answer is yes. I've definitely sensed physicians around, you know, colleagues of mine who have experience burnout, unfortunately. I think as a field in general, I think pain medicine, I think we're lucky to have get to work with huge teams, including APPs, rad techs, nurses, LPNs. There's so many different individuals that we get to work with, and I feel like I've noticed a lot of colleagues across the entire healthcare team have experienced burnout at different stages of their career. Um, in terms of signs and stuff, as I mentioned in one of my slides earlier, it's very hard to sense that at times. It's very, a lot of times as healthcare professionals, we um, tend to feel like sometimes that we're, invincible and we could kind of withstand anything, or we tend to like, underplay those symptoms. It might be a sign of weakness kind of thing. And so we tend to underplay it. But so I think that, it's hard to kind of sense that sometimes in some of our colleagues. In terms of your question as to why I believe or why I think rates of burnout may be increasing, especially since the COVID pandemic, I think part of it could potentially be due to our healthcare system and just insurance and stuff like that. I think the way our healthcare field and the financial kind of landscape, the way things are moving, it's not only academic, not only private practice, but I feel like even academics, it's very financially driven. And there's different systems are trying to make as much money as possible and get the most out of their staff as possible, prioritizing the financial aspect of things and not as much their staff health. And we always say things that we're trying to emphasize patient care and things like that. But I think at the end, money drives the field in healthcare a lot. So I think the way in terms of reimbursement, and I don't only mean insurance, but just like our healthcare reimbursements are going lower, and we're being asked to do more. So we're having heavier workloads, but yet we're not getting compensated as much for it. Another potential component too is just as Megan alluded to earlier, not having control, and that lack of control could also be due to just the lack of resources. And I feel like in large academic hospitals, there's a lot of resources and that's available, but it's often the smaller hospitals and other types of settings or even private practice that does not have that backing of a large academic institution that can potentially be at higher risk for not having that available resources and hence lacking that control. And I think the way when COVID pandemic happened, it made things like virtual meetings and stuff, a normal thing. But now I think we're all trying to undo that and trying to make that less of a thing and kind of maintaining a work-life balance. So I think there's a lot of factors. It's hard to kind of say what's the biggest driver, but I think it's very multifactorial. There's a lot of different potential things that could be contributing to burnout amongst all healthcare professionals.
Thank you for that. Yeah, and I think you pointed out some of the additional layers to this problem, certainly. So as we're kind of starting to wind down our conversation together, I guess one of the things that I would pose to you both, and I'll go to Megan first and then back to Dr. D'Souza, is if you were to recognize signs or symptoms of burnout, let's say in a colleague, one of your healthcare team members, how would you approach them or what would you recommend? Megan, we'll start with you.
Okay, this time I'm not as happy to be picked first. I think, so this boils down to how do you have a hard conversation, right? And I think I would honestly use the same skills that I use having hard conversations with my patients. And I think one of those things is just really what is in best service of this person. Like, how, can I take one for the team and be uncomfortable if it helps this one person? And that's how I think about it, right? Because I think like if I really saw somebody struggling, and maybe it just starts with hey, it looks like you're really having a hard time. I know the work here we do is hard. Is there anything I can do to help you? And just kind of coming at it from a non-judgmental part. I think the hardest part, honestly, is deciding to have the conversation and going ahead and doing it. But maybe that's just me. But I really, I mean, that's how I psych myself up for hard conversations with my patient. It's like, if this is going to help them, I'm willing to be uncomfortable saying it for the outcome of them being helped. And then I think there's all the other things that we talked about, right? Like trying to change the conversation from complaining, giving legitimate praise, you know, trying to offer other suggestions or viewpoints. If there is a way that you can take off some of their workload and give them a break or cover them for lunch or, you know, whatever, then that's great. But I think sometimes it's just acknowledging it and being like, listen, I've had a tough time too. I'm here if you need anything. Because I think we don't like to look vulnerable and we don't like to feel vulnerable. And you know, I think really in the long run, of course, we need systemic change to help burnout, but I also think we need a grassroots effort, right? Like I don't think a grassroots effort should be under appreciated, I guess, because like every nurse that we can keep in the workforce, every doctor that we can keep in, every APP, every medical assistant, the impact on patient care, the impact on the culture of not losing people all the time, the impact on financially, right? Not retraining, and it's just huge. Like impacting one person makes a difference. So I think that's the pep talk I would give myself beforehand. And then I'd probably sweat and then I'd go talk to them. But
You took us through all the stages, Megan. Thank you. Dr. D'Souza, we'll take it to you.
Yeah, I echo all the words of wisdom from Megan. Those are all excellent points. I'm just going to repeat some of the things just to place some emphasis on some of the points that she made. So I think maintaining an open line of communication that's just non-judgmental. I think that's one of the biggest things. Megan also mentioned having the conversation initially is the hardest step. I can tell you that other colleagues of mine have approached me when they have been afraid that I'm potentially burning out, and I can tell you. Maybe at the time I'm like, please, leave me alone. I don't want, I'm fine. I'm totally fine. That's, my discomfort with that vulnerability at that time. In hindsight now, I really appreciate what they have done for me and kind of helping open my eyes and kind of helping me, really, place an emphasis on self-care. I think they've all come from a good place. So again, just kind of reiterating, having an open line of communication, maintaining, no judgment, and then also just kind of maintaining privacy and having that conversation somebody you could trust, because all this stuff, we don't want the whole world to kind of know about it all at a time. So just kind of finding that person that you can trust, maintaining confidentiality is very important. Another point that Megan mentioned is just kind of sharing tasks, being willing to cover if they are, if they're overburdened, get their mind off of work and help them handle other things. I think that's a very important thing. And then also, again, reiterating another point that Megan brought up is just showing appreciation and acknowledging whenever they've done a good job or even if things don't work out in terms of the patient outcome, as long as, if they're trying hard, acknowledging that they've put in the hard work and they have done their due diligence in terms of delivering quality patient care. I think is a very important thing.
That's great. Thank you, guys. So I think for those, in attendance tonight, we discussed kind of the background of burnout, where that term came from, what are the subskills utilized to measure burnout, what are the surveys or measurement tools that are available to us. We talked about the current statistics on burnout, the prevalence across occupations, and then we've had this rich conversation about kind of how do we attack this problem from all angles and take care of ourselves, take care of others, have those difficult conversations. And so I think that's probably a good summary of all the things that we've covered in this short period of time together tonight. I appreciate you both, especially again, as we're taking time, away from ourselves, our families, and being on this call together and trying to kind of give back to this community the best way that we know how. And I have been monitoring the chat, the Q&A here. We must be doing a good job because I don't see anything coming in from those in attendance tonight. And so with that, I think I will wrap us up a few minutes early. Megan and Dr. D'Souza, any closing remarks? Or are you guys good? You feel like we covered it all?
I think we covered it. I would just say, like, I appreciate everybody who's doing the work that you're doing. So if you're having a bad day tomorrow, just say to yourself, Megan appreciates what I'm doing. Just put a little sticky on your computer. But no, I really am happy to be here and happy to connect with everybody.
I
Thank you for
really
that.
enjoyed this discussion, and I also learned a lot from you, Megan. That was a lot of great points that you brought up as well. So appreciate
Great.
this
Thanks.
discussion. Thank you all.
All right. Thank you, Nance, for having us. We appreciate you. And with that, everybody have a great night.
Thank you. Good night.